you. My warm wishes from I am Dr. Sudhakar. I am a senior consultant physician from Chennai, Porur, Chennai. I have been practicing internal medicine for almost 3 decades. I have been involved in the teaching, practice, research, administration of medicine. And I also deal now more with lifestyle disease. Today we will be dealing with hypertension. So hypertension is a word which we use medically, but the common term which people use in lay person's language is high blood pressure. So when very often people get confused when to say high blood pressure. Sometimes people just say they have some symptoms like tension, headache, giddiness, and all. But we should keep in mind that hypertension is a silent disease or silent killer. It not always everybody will have symptoms. So we have two groups: asymptomatic and symptomatic. Asymptomatic means no symptoms they will have. They will come for casual blood pressure checkup, like during employment checkup or during some camps or during evaluation for any other disease illness. That time we detect them to be hypertension. The other thing is they have symptoms and they report to the doctor. The usual symptoms they have is headache, giddiness, breathing problem, and neck pain, uneasiness, chest uneasiness, and palpitation and all. So those symptoms also they present. But we should keep in mind that only 50% of the people who have presented symptoms, remaining 50% are asymptomatic. What should be the cutoff point? The cutoff point should be the ideal blood pressure or optimal blood pressure is 120 by 80, but very rarely we can get that value. And we should also keep in mind that blood pressure is a continuous variable. That means it keeps changing from time to time, person to person, the same person from time to time. So every minute keeps changing. Depends on like certain conditions can increase your blood pressure, like less sleep, you're involved in some emotional status, like some argument with somebody, or you have any pain, or sometimes in constipation when you're not past stools or full bladder. These are some of the conditions where there may be elevated blood pressure. And always early morning, sometimes when we are in a busy schedule to go to our office and all that stress, it can increase. Basically, it's the release of catecholamines, that adrenaline, noradrenaline, which can cause elevation of blood pressure. Then usually what we do is the rule of half or rule of twos. Whenever a patient comes to blood pressure, we check the blood pressure on two occasions. We say not with one reading. Please come some other day. We will recheck. Then in the same time, we check on both limbs. Usually we check on the right upper limb, but also that is by convention because most of us are right-handed. So in office blood pressure, that is in the clinic, we check the blood pressure. We also check on the other side, so take the readings on both. There is usually a variation between the right and the left because of the right-handedness plus right side blood circulation is more. Some variations will be there. Next is we check the blood pressure in sitting and standing position. So two visits, two readings, two limbs, and two minimum we need to check. Sometimes when we have patients have a doubt, we also tell them nowadays home blood pressure meeting monitors are available, electronic, automatic. So we charge them to check at their house and maintain a diary. So the day we can check them to the 2 times or 3 times, or during holidays on weekends like that, they can check it out. Then we come to a conclusion. If it is one third up to 140 by 90, we call it as borderline hypertension or pre-hypertension. When it is more than 140 by 90, we call it as systemic hypertension or hypertension simply, because there are other hypertension we can get in lung, you can get in renal, and also we call it as systemic hypertension, common medical term, or hypertension in particular. Then why should we worry about hypertension? What happens sometimes people get, why should I control my blood pressure? I control it normally like that. So reasons of pressure they can lead to complications. The usual complications they can have is the usual affects three important organs. One is the eye, which we call it as retinopathy. The eye patients can have absence of vision, blurred vision. Sometimes it can bleed into the eye and can cause life-threatening vision loss. The other thing they can have is they can have hypertensive kidney disease. So they can have hypertension, the nephropathy, the kidney failure the patients can develop. So they can land up with a kidney renal failure or kidney failure. Other thing they can have is they can have affect the heart. So the patients can have heart attacks or what we call as myocardial infarction or heart attacks or infarction. and cardiac, they can also cause cardiac failure, heart failure. So these are all the three important manifestations. They can cause complications. So there are many more else. They can also cause the high blood pressure will cause some rupture of the blood vessels. So the blood vessels can rupture in the brain. They can have intracerebral hemorrhage and they can go to coma. They can have multiple places they can bleed. So the common things which you usually see is in the brain, heart, eyes, and kidney. So they can cause, once the damage is caused, it will be very difficult to restore to normalcy. Then sometimes we have patients who are in borderline hypertension or even in the established hypertension. First thing we advocate the patient is what is called as lifestyle modification. This lifestyle modification involves some 7S. I will tell you one by one. The first test is that is to reduce the salt intake. Globally, there is a high intake of salt. WHO has recommended that we should take only less than 5 grams of salt per day, that is sodium chloride. But overall, if you see the amount of sodium chloride consumed by Indians is somewhere about 15 grams. We are consuming more than 3 times. So we have to cut down all visible salt and avoid all the common salt, high salt foods in our Indian diet are pickles, puppets. Then most of the tinned and processed foods, they are sodium is added as a preservative. Then many of the fizzy drinks, they have the sodium benzoate that can cause aerated drinks, fizzy drinks, high sodium. Then it's also seen in the soda bicarbonate or baking soda. So it is added, which is used in most of the bakery products. So we always tell the patients to reduce as far as possible their salt intake. The next is sugar. Some of the patients have blood sugar, so you ask them to reduce the sugar intake. Then the carbohydrates, that is also the saturated fats. We ask the patient to move to more for polyunsaturated and monounsaturated fats. Most of the fat we are taking is saturated fats, which is trans fatty acids. So we ask them to avoid all the reduce the fat and move to polyunsaturated fatty acids like rice bran oil, then sunflower oil, safflower oil, and also monounsaturated fats like our gingerly oil, some of the sesame oil, gingerly oil. So that is one. Then reduce the stress. Then we also ask them to do some exercise. So the common exercise and cheapest exercise is all the aerobic exercise, walking, jogging, cycling, at least minimum half an hour per day. We tell the patients to do them. So these are some of the common lifestyle modifications we tell them. You can reduce the stress by using some simple things like doing meditation, relaxation technique, yoga. All these things can reduce the blood pressure. This is lifestyle modification. Lifestyle modification is a very important for all stages of hypertension. Initial stages, it is very useful. Once the patient has got established hypertension, we have to give them blood tablets for reducing the blood pressure. So we use all these medicines as antihypertensives. So these drugs are given by doctors. You have to go to the doctors, and they will, if you are a local consultant, local family doctor or local physician, and check the blood pressure. And we need to do some tests to find out if there is any complications. And then we also stage the level of hypertension, and we find out all the associated disease, like usually the hypertension, blood sugar, diabetes, there's blood sugar, high cholesterol, all are interrelated. And we also need to find out any other causes of hypertension. Most of the hypertension diseases which we call, there is no reason. It is called primary hypertension, or it is due to some genetic, which we call as there is no single gene, multifactorial inheritance, and we need to control them. So then there are certain special hypertension which can occur in other conditions, like one of the common hypertension which occurs exclusively in things like gestational hypertension or pregnancy-induced hypertension. These are some of the other common hypertension we need to know. So depending on the stage, what disease you have, what complications you have, the physician will prescribe you medicines, and it is you need to take the medicines regularly at the prescribed time. Then we also have nowadays community and activities at hypertension, especially by WHO. WHO, World Health Organization, has declared the what is called as World Hypertension Day, which is celebrated every year. And on this day, we have a choose a theme. So eat healthy, do exercise, lifestyle modification. We organize camps we distribute books, and we also have public lectures so that patients, whatever diseases or whatever doubts or myths and facts and fallacies they have, they can get it clarified. So hypertension is a very important disease. So it is need to control, detect, control, and bring it. It's not a single time we cannot eradicate. It's a lifestyle disease. So lifestyle modification is the most important. And you need, once you are brought under control, you need to have also monitor. You have to undergo periodic checkup of blood pressure uh, with your local physician. So I think I have covered in a nutshell all about hypertension. Thank you.